Oxycodone is a thebaine derivative developed in Germany in 1916 and clinically introduced 1 year later. Like other opioids, oxy is a selective agonist of the CNS mu-opioid receptor, eliciting the typical effects of euphoria, analgesia, and sedation. Mu-opioid receptors are primarily located in the periaqueductal grey area and within the dorsal horn of the spinal cord. Following the stimulation of nociceptors, primary afferent neurons carry the pain signals to the spinal cord and synapse onto dorsal horn neurons. Opioids such as oxycodone bind to the mu receptor, inhibiting the voltage-gated calcium channels and activating potassium channels, causing neuronal hyperpolarization, in turn preventing neurotransmitter release. This ultimately results in analgesia. Other mu receptor-mediated effects include euphoria and sedation, all of which promote opioid abuse and addiction. It exhibits a 20-fold decrease effect relative to morphine in binding to the mu receptor. However, the bioavailability of oxy is 3 to 4 times higher when orally administered than that of morphine. You can snort it, smoke it, stick it up your bum. Oxy can achieve much higher CNS concentrations due to the presence of an unidentified transporter that promotes movement of the drug across the blood-brain barrier. Its favourable pharmacokinetic profile and its reduced side effects play major roles in facilitating the addictive and dependent properties. Being an opioid, it is used clinically to alleviate neuropathic and cancer-related pains. In terms of its elimination from the body, oxycodone undergoes hepatic metabolism via CYP2D6 into noroxycodone and oxymorphone. These are then renally eliminated as free unconjugated compounds. Contraindications include users suffering from renal and liver failure, alongside a large list of prescription drugs such as antidepressants, antipsychotics, and antiarrhythmics that can facilitate systemic toxicity. So what's the big deal? In response to rising opioid abuse patterns, a Canadian research team conducted a 5-year study into opioid detoxification programs. Their results found a 50% increase of oxycodone addictions between 2000 and 2004. Similar patterns are expected in Australia, where oxycodone prescriptions increased by 152% between 2002 and 2008. Furthermore, detection of oxycodone deaths in Australia, as reported by a Victorian coroner, has seen a 21-fold increase. Of these deaths, 52% were unintentional toxicity and 20% were a result of intentional self-harm. Pretty earth-shattering, right? To knock your socks off even more, an estimated worldwide statistic shows that over 36 million people currently abuse opioids. So how has the hillbilly heroin stigma been associated with oxycodone? It was found that 40% of young adults living in the West Virginia and neighbouring country towns were addicted to oxycodone. This is where the first epidemic appeared to occur. The name for the drug within these regions were known as poor man's heroin or hillbilly heroin, but the question of why this occurred remains largely unanswered. Until now! In 2007, Purdue Pharma pleaded guilty in the US District Court to the misbranding of oxycodone with the intent to defraud or mislead. Purdue were found guilty of falsely misrepresenting the addictive qualities of the prescription drug. Sales representatives gave false information to health professionals, claiming it would provide a patient with reduced euphoria and in turn a reduced potential of abuse. Purdue were fined in excess of $600 million, declaring it as one of the largest ever paid amounts by a drug company in such a case. This false representation led to the overprescription of oxycodone, initiating the outbreak of the drug abuse and addiction that spiraled into its current state. Within Australia, oxycodone is classified as a Scheduled 8 controlled substance. Nonetheless, it exhibits proliferating patterns of abuse throughout the country. In order to counteract the oxycodone dilemma, tamper-resistant formulations of oxycodone have been designed to make it more difficult for abusers to crush, snort, or inject the drug. The USA and Canada have both recently begun to promote the use of tamper-resistant formulations to prevent opioid-related harm. Tablets that contain intact technology are difficult to crush and gel when combined with small volumes of fluid. Exact costs to the Australian government relating to opioid addiction are unknown. However, it can be firmly announced that the costs to the American government are $55 billion in 2007. The main contributors to these costs are rehabilitation and treatment. In terms of this treatment, the main drug for suppressing the withdrawal symptoms comes in the form of methadone, with 68% of Australian addicts partaking in associated programs. The remaining third are either prescribed buprenorphine or naloxone. Contrary to what namesake may imply, hillbilly heroin presents a major challenge to society as a whole, especially with the ever-increasing prevalence of opioid addiction. However, this should not detract from its clinical importance in alleviating chronic and severe pain. The oxycodone dilemma flourished due to the shortcomings in regulation and legislative action, and greater initiative from healthcare systems is vital to ensuring that oxycodone can continue to be used efficaciously and safely. I bet that shady giraffe never told you anything about that.
You gotta say no, 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 no to drugs. I want to be in the chicken club. You gotta say no, 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 no to drugs. I want to be in the chicken club.